Hey loves, welcome back to my channel. It's Michelle here. This video marks the first ever episode of the Ask Nurse Michelle series. I posted on my YouTube stating that I wanted you guys to come to me and ask me any questions you have pertaining to nursing, life, faith, and I know sometimes the comment section can be a little intimidating for people to really leave comments, so I opened up my email to create a safe space for you guys to ask me questions. I got a couple of questions over the past couple of months. They gave me permission to make this video with their questions, and so I am going to proceed today and talk about what we discussed in the emails. I believe that sharing this information can also benefit you guys out there. You guys feel free to leave comments in the box below also answering these questions. If there was anything I missed or if there's anything that you disagreed with that I said, please let's have a conversation in the comments below. So let's get started. So the first question is from someone named Abby. She wants to be referred as Abby, and Abby asked me this question, which I will be reading to you guys, and I'm also going to post it up here too, and of course keep certain things confidential. This is a question that Abby asked. How do you deal with parents, especially African parents, who completely disagree with your career goal? I will be doing my accelerated BSN this May at set school, and I got a scholarship where it pays for half of my tuition, but I would have to work 3 years at this hospital. I apologize if this question seems rude, but my parents, who are Ghanaian, wanted me to get a government job or become a doctor, are telling me all sorts of things. The pay is not well, you will not be satisfied, this job is beneath you. Knowing that nursing is my calling, because I love the direct patient contact and nursing models, speaks to me way more than the medical model. I am super excited to start my nursing journey. My career goal is to become an FNP or a dermatology or a CRNA. I want to keep my options open. This was a really interesting question that Abby asked me, and I'm also Ghanaian. I am from Ghana, and she is as well, and her parents are basically disagreeing with the career of nursing. They're telling her that it is beneath her, quoting what she said, and there is just this huge misconception of the career of nursing. It deeply saddens me that some people think that this job is beneath them and that we are practically servants, essentially. I definitely think it takes a different kind of heart to understand what we do, and I feel like it is our job to educate people with the facts of the matter pertaining to the career, as far as their own personal opinions and their own ignorance towards the career. We can't really do much but to pray for them, really. But definitely educating people with the facts. Her parents' concerns is that she is going to be working a job which will not pay her as much as they would like her to be paid, basically. This is why they want her to pursue a career in where people evidently make more money, like being a doctor or I guess somewhere in the government. That was Abby's parents' concern, and I think they could have came about, you know, telling her that in a much nicer way than demeaning the career of nursing. Nevertheless, as a parent, you want the best for your child, and that is what they think is best for her. And Abby is in love with nursing. She loves nursing. That's where she feels her calling is. And so I told Abby that the best thing to do was to really educate her family. Abby has goals to potentially become either a family nurse practitioner or a CRNA, which can all give her the doctoral degree that her parents want her to have, essentially. And through nursing you can actually achieve that by going through either nurse anesthetist school or going through a doctoral family nurse practitioner program. So the end goal is essentially the same. So I told Abby to just thoroughly educate her parents that she's going to be working as a provider, prescribing medications to people, taking care of people, and also in other certain states she can open up her own practice. If she takes that FNP route, she can open up her own practice, essentially be a doctor in her own practice. So I told Abby to just really educate her parents on the path that she wanted to go on. And also, like, by educating them, my hope was that they would recognize their biases towards the nursing community, and also that can potentially change their mindset on their ignorances towards the career. So if you guys have any other suggestions pertaining to Abby's question, please leave it in the box below. And how can we do better as a society to educate people in what the career of nursing is, and that we are not essentially just servants and we aren't beneath other people's careers. Alright, so the next question comes from a subscriber. This is what she emails me. Hi Nurse Michelle, hope you and your family are doing well. My name is Shannons and I have been watching your YouTube videos for a while now and I just love them. I'm currently in 11th grade and my dream is to be a nurse because I really love this passion to just help people that are in need and people that can't help themselves. So my question is, do you have any advice for high schoolers that would want to be a nurse? And great question, Shannons, and I know that this question will help a lot of people out there. I replied back and gave my suggestions to Shannons on how to become a better candidate when it's time to apply to nursing school. Shannons is in 11th grade. I told her to take her anatomy class in high school serious because this serves as the foundation into the things that she'll be learning when she truly embarks on this journey to become a nurse. I also told Shannons that if her high school provides a nursing program, because I know certain high schools do, and where students can venture on the path to become a CNA while they are in high school, or even an LPN in some schools. So if her school provides that, she should definitely take advantage of it and take those classes to eventually get her foot into that nursing door. Because Shannons is still in high school, I went into the different routes of attaining the degree in nursing. You know, she can either choose to do the associate's degree route or go straight into her bachelor's, and so we discussed that. So basically the associate's degree is a 2-year program in a community college in where you can attain your associate's in nursing degree. When you graduate from that program, you can take your NCLEX and directly work as a registered nurse, but within 5 years of your career you are required to attain your bachelor's as well, and I explained that to her. I then talked about the bachelor's degree route in which I partook in. With the bachelor's degree, it's a 4-year college degree. After I graduated from high school, I applied to a college in my state and I got accepted. The first year that I was there, I did everything in my power to have the GPA I needed to get into school. I finished my first year of college with a 3.8 GPA, and so I think that's what really led me into getting into the program at my school. I did everything in my power to get A's, really tried to get all A's in all the major classes. I took my prerequisites that year. I took anatomy that year. I took my second science that year. I took biology 101 that year, and the goal was to really do well in those classes. I was able to pass those classes with B's, in which I was happy about, but definitely those sciences, your prerequisites, try your best to get A's in them because nursing is filled with a lot of science. They like students who know how to succeed in those science classes. So biology, anatomy, microbiology, physiology, you need really good grades in those classes in order to get accepted into your program. After my first year, I applied to my program and I got accepted, so I started my nursing degree my second year of college, and I was able to do that for 3 years and graduate with my bachelor's of science in nursing. I went to school for a total of 4 years to attain my bachelor's of science in nursing. I also told Shannons about the importance of education, importance of working hard. Nursing school is not easy. It is extremely difficult, and you need a lot of time management, a lot of discipline, a lot of work ethic to really make it, and I emphasized that. So in everything you do in school, please work your hardest. Work hard. Do not slack off. It's going to hurt you in the end. I also told Shannons to possibly volunteer at any hospital she can get, because sometimes your programs like to see these extracurricular activities that you do, and that can look really good on your resume. Also gave advice on the application process of the program. When she's writing her reference letter, she should really make her goals clear. If she has any philanthropic endeavors that she wants to potentially use her degree for, she should definitely mention that, because people like to read about things like that. Selflessness, because nursing is a selfless career, they like to see the heart behind it. When you're writing your personal statement, make sure that the reader can feel your passion for nursing and they can feel your heart toward the career. For this last question, the subscriber wanted to remain anonymous, so I'm not going to mention her name, but she agreed to let me read her question in this video, so I'm going to read it. She says, Hello Michelle, my name is ... I am a registered nurse in Atlanta, Georgia. I have been a nurse for about a year and I would like to transition to another unit in my hospital, preferably cardiac ICU or PACU. I currently work in a cardiac thoracic surgery unit. I loved your video about increasing your salary to $60 per hour. I hope I can one day soon have an ICU or a PACU PRN while doing some travel nursing. I am nervous about the transition to another unit. How would you prepare for such a transition? Would love to receive any interview tips and how to go about resigning from my current position. Kind regards. And so I've actually received quite a few DMs and emails about potentially transitioning from a med-surg floor into critical care. A lot of people have asked me questions about this, so I'm glad she agreed to allow me to read her question in this video. So basically, I referred to my ICU versus PACU nursing video. I feel like it's such an informative video for anybody who wants to educate themselves more on what it really means to be an ICU or a PACU nurse, what the environment is like. I strongly suggest watching that video. I'm gonna actually link it in the box below so that it's easier for you guys. I also referred her to my other PACU videos because I think those are all valuable gems to really know what she's getting herself into. But to answer her question, she was thinking about either the ICU or PACU. I told her that I would suggest for her to go to the ICU first, just because I feel like she needs that fundamental critical care knowledge, and the ICU is a great place to learn. You learn about so many things, vent settings, drips, procedures. You learn so much. I feel like in order to be a really strong critical care nurse, I think it's best to start in the ICU. And in regards to like the interview questions, I suggested to just really be yourself. Do not pretend to be anybody else that you are not, because I feel like your managers can't tell the fakeness through the conversation. Be authentic and be yourself. It is also very important to present yourself as indispensable, meaning that you want to say things that would cause them to really want you on their team, something that would make you irreplaceable. I asked her if she had any experience doing things like working with the sauna site, like the ultrasound to insert IVs. If she has any skills that will be beneficial to the unit, she should definitely mention it in her interviews. Anything really to make you come off as indispensable, I think will guarantee you the job in your interview. Also, I told her to think about scenarios in where she encountered certain moral situations. I feel like a lot of the interviews I've been in, like a lot of the managers asked me questions about how I handled certain workplace conflicts, because they really want to know if you are indeed a good team worker and a people person. We have those coworkers who are just nasty and mean. I don't think managers want that on their unit. That's why they really probe in those morality type questions. I also wanted to know what could help her to better prepare for her new role in the critical care world, and I suggested reading the Barron's CCRN book. This is a book people usually use to study to get their CCRN certification, which I used to attain my CCRN earlier last year. I will leave a link to that in Amazon below. For anybody else who is transitioning into the ICU, I think it's a great book to really learn. It goes in depth about vent settings and certain critical things that us nurses need to know when we're taking care of patients. It is such an informative book, and I definitely recommend it for anybody who is transitioning into the critical care role. In regards to how she should go about resigning from her current job, I told her to not really think about the team she's leaving, because hospitals will always hire new nurses. Like, they will be fine without you, but always do it in a professional manner. Give them your 2 weeks notice, or to be really nice, to go the extra mile, give them a 1 month notice. You know, do it as professional as you can, but just don't dwell on the fact that, oh, they're gonna be short without me, or this, that, and the third. They have plenty of money. They can hire a float nurse. They can hire a travel nurse to replace you. Do not worry about that. Think about your career and where you want to be within the next couple of years and how you can get there. So yeah, those were all the questions. If you guys really enjoyed this new segment, please give this video a thumbs up. And if you have any other questions that you want to ask me confidentially, please email me. And of course, if you want me to use it in my next Ask Nurse Michelle video, then please let me know. My email is open to all questions. questions. I really want to create a safe space for you guys to really get to know this career of nursing from someone who's been there and done that, who can give you genuine advice. And also with faith, like y'all know I love Jesus, so if you guys have any faith related questions, please ask me in my email. If you don't feel comfortable asking me in the comments below. Once again, do not forget to like this video, subscribe to my channel if you have not, share this video with somebody who you think will need it, and I'll talk to you guys in my next one. Bye.